The other great thing is laser treatments, you really can't do it on every type of skin type. If you're genetics or if you have darker skin, you can't have that treatment done. But with the DermaRoller, you can have it done on any type of skin type, right?
That's right. Now, the DermaRoller is a much safer procedure. It is a medical procedure, and I know we're going to talk about that in a little bit, because you do have to properly screen patients. You have to have a medical practitioner take notes and make sure that there are no pre-existing conditions that could compromise the response. But you're absolutely right about the skin type. There is no contraindication based on what we call the Fitzpatrick score. And you have a different Fitzpatrick score based on how fair or how dark your skin is. And with lasers, you absolutely cannot work safely on very dark skin. And another key advantage of microneedling technology, because the DermaRoller healing, I think, is more profound than after lasers, but more importantly, depending on the case that you'll review, you can select a needle depth that can treat a patient. So let's say you have somebody with what we call hypotrophic scars. So these are scars that are beneath the surface of the skin, and it's most common for acne scars. I often recommend clinics that I train, they bring in patient models who have acne scars because they will always be the biggest fans. They are the best marketing tools, and they will rave about the treatment because they've usually tried everything else with great frustration. So now when you have this microneedling technology that'll break up the scar tissue below the acne scar that's actually tethering it or pulling it down below the surface, so you have that crater type appearance. But what will happen over time after the procedure is you'll actually see the scar fill in from the bottom up. It's typically a series of procedures that takes to do that. Now, the most common package for lasers that were sold was basically a package of 4. We commonly recommend for DermaRoller anywhere from 1 to 3 treatments. It could be 3 up to 5 for patients with acne scars. But you're absolutely right about the downtime. Yes, your skin is red and it's hot after the procedure. And the worst case scenario is you look like you have kind of a mild sunburn for about 12 hours. And it's after 12 hours that we say you can put makeup on, and that's it. We say no social downtime with the DermaRoller because you don't have to stay at home. You can actually go out. Yes, your skin will be a little bit red, but that's it. You can put on makeup 12 hours after the procedure. And the absolute worst that I have ever seen is when you actually have this, let's say, conveyor belt of new cells pushing out the old cells. You know, when we're babies, we're turning over the outer layer of our skin 2 or 3 times a day. When we're 18, it's still once a day. By the time we're 25, it starts to slow down. And when we're in our 40s, we're lucky if we get a turnover to the outer layer, every few days, which is why things like mild peels and microdermabrasion are popular, but they only address the very outer layers of the skin. One of the beauties of the DermaRoller is not only do I get a thicker epidermis overall, but I dramatically turn up the speed of those new cells. So they might flake off just a little bit, but you have brand new shiny skin underneath.